So I says to Mabel, so I had this patient, right? And this guy has the audacity to have, some of that leg pain, the nerve, honestly. Now, he's had a few knee surgeries, but that wasn't the issue at the time. Surgeon did a great job, as they do. But on movement, on walking, on swinging that leg back and forth, or going up the stairs even, there was some spasming happening, some seized up and contracting muscles. Kabong. Okay, that was a bad impression. Even passive movement, even slow, medium speed. We'll say medium speed movement. The hip would seize up. The hip moves well, though. The hip itself was totally fine, and when moved particularly slowly, particularly gradually, even the muscles of the hip going in all these various different directions, they as well were relatively mobile. So it's not really a hip problem. Instead, what we did have was T11, T12, as low maybe as L2. All of that was fired up. All of that was all over the place, sore and painful. Kabong. No sense in even naming it, really. You call it whatever you want, but it's just what's the point? Now this seems unrelated to this. However, there is some shared sensation between the two. There is some overlap, and some of the nerves that start all the way up here go down as low as here, and they all have names, but it's not really important. Those nerves wrap around. They pass down and around from the spine to the region of, let's say, the inguinal, the hypogastric, the iliac area, and as far as sometimes the thigh. And so there is an overlap between those 2 points. Now, that irritation in the middle back, that irritation that's going on all the way up here, it's as if it was saying that something was wrong. Perhaps it was giving the information to the body, to the central nervous system and the reflexes, as if it was saying, this joint right here is moving. It's moving excessively. It's moving way too much. And so instead of calibrating properly, instead of reporting accurately, it's as if it was saying it's already over lengthened. And so instead of just having it move normally, it was telling it to go into spasm immediately, inappropriately, but immediately on any movement. Better safe than sorry, essentially. Now the thing is, when held with a relative medium pressure for a little while, withheld with a continuous pressure for a little while, that's soft and gentle and, not too mobilizing, what was found is it decreased the effect of that spasm. It didn't go away entirely, but it reduced just a bit and made it so that it was easier to move that leg around. Now, mechanical pressure tends to interrupt other signals, tends to interrupt other sensations, inhibiting it, you might even say. Pain and irritability can be blocked, and when resolved, perhaps even more.